I am professor at George Mason University and director of Health Informatics program. I also direct something which is called Machine Learning and Inference Laboratory. By training, I'm a computer scientist, but I moved to healthcare domain many years ago. And what I really do is I combine my technical expertise with what I learned in the healthcare over the many years, and do research. Actually, most of our faculty do independent research in the health informatics area, and obviously I also teach and run the program. Our program is KHIM accredited, and many of you have heard of Commission of Accreditation for Health Information, for Health Informatics and Information Management programs. It is the professional body that accredits Health Informatics program. There are 20-something Health Informatics accredited programs right now across the nation. Our program was, I believe, 11th to get accredited, one of the early programs. And KHIM ensures that our standards of education are very high. So there are lots of online programs out there, and but our program, we have both actually on-ground program and online program. And what KHIM, for example, makes sure is that what we teach students on campus, we also teach students online. So in terms of your educational material, in terms of what you receive, what instructors teach you, what you get at the end through the program, there should not be really difference between a regular on-ground program and what you're getting in online programming here. So the curriculum will be the same. Lots of other things are actually the same. It's the delivery of the courses that are actually different. The program can be completed in somewhere between 20 to 24 months. For most of you, it will be actually 24 months, which is exactly 2 years. If you look at 12 required courses in the program, that takes exactly 2 years. Some of you that specifically come with background in computer science or background in public health may be able to waive 2 introductory courses or one of the 2 introductory courses, and that may make the program slightly shorter, go down to 20 months to complete, which is 10 courses. But those decisions are made once you're admitted to the program, and you need to talk to the advisor and actually find out what's possible, what's not possible. Somebody will need to review your transcripts, look at the skills that you have, and all the other things. All right. This is a quick look at the curriculum. The first course listed there is Foundations of Public Health. And this is course actually that can be potentially waived from somebody that comes with bachelor's degree in accredited public health program. The same for computational tools in health informatics. If somebody comes with a degree in computer science or IT or something similar, or can demonstrate really strong programming knowledge and IT knowledge, we can waive that course. Rest of the courses are actually required. You have things like Introduction to Health Informatics, Healthcare Databases, and other courses. At the end of the program, you have a capstone. Capstone, there is a sequence of courses that start with workshop in health informatics, which is really like an industry immersion program in which you start working as a group on a large real project in health informatics. Then you move to the actually capstone practicum. And for the actually capstone, many of you will end up doing internships somewhere outside of the university. And those internships aren't usually like undergrad internships, which you go out there and do something. They're actually very project focused. So the faculty who teaches the capstone at Mason will need to agree to the topic with your preceptor out there. And you need to write a report at the end. You need to do a presentation at the end. And there are several other requirements. So it's a very project specific, usually outside experience that you do. All right. We have 2 concentrations in the online program. One is Health Informatics Management concentration, the other Health Data Analytics concentration. Let me start with Health Data Analytics concentration, because that one is a real data science in the health program. This is where you learn hard data science skill. You get programming, you get hard statistics, you get data mining, you get machine learning, you get what people call AI right now. All of those things are part of this data analytics concentration. And this is the most technical and the most hands-on concentration that we actually have. Health informatics management concentration focuses more on soft skills. This is really about project management in health IT. There is always some statistics, but you get things like privacy security, like behavioral health, like things that what to do, organizational behavior, things that are legal aspects of health administration, things that make you run large health informatics projects and be able to interact between IT vendors and healthcare organizations. You'll be one of those people that sit in between and really make the translation, make the connection between IT people and health administrators or clinicians, because those two groups don't really talk to each other. And one of the role of informaticians is to provide this translation. So health informatics management concentration is really about this translation, about running those large projects from different aspects, and have data analytics is about really data science and hard data analytics skills. All right. Learning outcomes. So a while ago, I went to my LinkedIn account, and on my LinkedIn account, I have lots of graduates from our program, in my connections, and I just started, to copy and paste their job titles, and there are a couple of hundred different job titles, and so they are all over the place, right? Very rarely we see jobs that are called something like health informatician. But once you start looking at actually requirements of the different jobs, and it can be anything from health IT consultant to data analyst to something that can sound completely bizarre. But if you start looking at job requirements for those positions, then what you really see is that these are things that we actually teach in the program. So we do prepare you for those jobs. Depending on the concentration, you'll end up with more technical jobs, something like a data analyst or machine learning specialist or whatever it is. And if you end up with health informatics management concentration, then your job position will be most likely something like a consultant or a project manager or something similar. But graduates from our program work for health IT vendors, they work for analytics companies, some work for hospitals, the insurance companies. We have some graduates from our program that work actually in the government at all levels. We have several graduates in the federal and state government, also a few in local governments, county governments, public health departments. So graduates of our program are all over the place. And you can, informatics is a very broad area. You can specialize in different areas. And it really depends where are your career goals. To a large extent, it also depends what is your undergraduate degree in. If you're a clinician, you'll always be a clinician, and you're building those informatics skills on top of it. If you already have degree in management, you always be a manager, and you're putting those extra skills on top of it. So to a large extent, when you end up, it depends where you're coming from and what is your education so far, and we can take it from there and teach you the informatics.
Alrighty, well, this is my section of the presentation. As I mentioned, I am an academic advisor, so once you guys start the application, are interested in our upcoming terms in the master's program, we go through, we as advisors help you throughout the process of the application process. So that looks like we obviously, like to see your bachelor's degree and have a 3.0 GPA. We do accept a GPA addendum if your bachelor's degree is under a 3.0 GPA. We also ask for your transcripts. We do accept unofficial transcripts, usually transcripts that are not sealed for a decision. We would need your officials by the time you're registered. We do also ask for your resume. An updated resume would be, the best option. Obviously, inputting any skills that you have in healthcare or IT, any technology skills that you have as well. We do ask for a statement of purpose or personal statement. Sometimes some people call that, which is an essay, usually about 750 to 1,000 words, which defines, your motivation, your professional goals, and how this program will help you achieve those goals in your future. We do ask for also recommendations. One preferably from a supervisor is required. You can add more than 2 references if you would like. Written letters are accepted, not required. So our program does a questionnaire format as well. Once you start the application, you are able to input your recommendations email. Once you do so, we send them an auto-generated email with a link to a questionnaire. The questionnaire is around 5 questions, should only take them about 10 minutes or 15 minutes to complete. Really simple, really quick to do, a lot quicker turnaround than a written letter. But if they have written a letter, they can always attach it to the questionnaire or send it to you, and you can upload it on your end. And then once you submit, there is a $75 application fee. So basically, my role as an advisor is basically to be your mentor, helping you throughout the application process, making sure nothing's missing, to make sure that your application is perfect upon review from admissions. So in a sense, we are basically your final draft in a way, and you're kind of like the rough draft. So once you start the application or request information, you would speak to someone like me. Alrighty.
Let me add a couple of things there. When you write your goal statement, and I serve, as one of the people on the admissions committee, we actually read those goal statements, and make sure this stuff is first of all well written, but also really talk about your goals. Sometimes I see nicely written letters that talk about everything, but why you want to do health informatics. So, make sure you really talk about health informatics, and make sure you do some research in, reviewing the coursework that we have, the faculty, the other things. So it is specific for the program that you're applying to, and really try to think through how you see your career, why you want to do health informatics, and similar things, because it's really about the purpose. It's why you want to do informatics and not anything else.
Absolutely. And I already got one, so everyone can, if you have any questions, please feel free to utilize the question and answer or the chat. I already got one question here. I have a bachelor's degree of occupational and health sciences. I do have experience working in the medical field for more than 3 years. Can I change my career path by pursuing to health informatics without an experience in IT? Would I be part in the program?
Okay, so let me answer that question. If you want a short answer, the answer is yes. If you want a long answer, the long answer is it has several parts. First of all, probably about 60% of our students that come to our program come from health-related background. We have nurses, we have physicians, we have pharmacists, health administrators, some are in the public health backgrounds. So there are the different ones that are coming with, health-related background. We have some students that come to our program with actually undergraduate degree in health informatics. There are a couple of undergraduate health informatics programs that are coming. These are relatively new programs. So for example, at Mason, we have undergraduate bachelors in health informatics, and some students from our undergrad program come to our master's program. They're slightly different prepared because they're informaticians from their undergraduate program. And the rest is either those that come with IT background, in strictly computer science, IT, or something similar, or those that have completely unrelated background. Once in a while, we get somebody in with biology background or psychology or something that is just unrelated, and it's fine. The program is designed to take a pretty wide spectrum of students. If you don't have technical skills, once you're admitted to the program, we'll ask you to complete what is called a bridge course. And that bridge course, it's a free thing that you get access to. You can complete it on your own pace. It has 4 components. First component is about really reviewing computer use, your computer skills, making sure that you're essentially a proficient computer user. The second part is about math. And many of you have not seen any math since probably high school. So, it's a good thing to refresh a little bit of math, before you actually join informatics program. and you'll start diving into more advanced statistics and other things. The third part, it's really overview about what informatics is. And last part, it's about computer programming. And even though it's a last part, I actually really strongly recommend everybody who has not have any programming experience to complete that part. One is about Python programming, and the other is about SQL and databases. And once you get to both, computational tools course, which is 70% of the course is about Python programming, or a database course, those faculty kind of assume that we start from zero, but the pace of those courses is really fast. So if you really have not seen Python programming before, you'll get lost in a couple of weeks. So we don't strictly require you to take this bridge course and prepare yourself, but we give you those resources that will make your life really, really easier once you take those technical introductory courses. And it's something that I strongly recommend. And again, the moment you get admitted to the program, you'll be added to the bridge course with those 4 components. Probably from practical perspective, probably the last part, the part 4, which is about programming, is the most important, but others are also important.
And then the next question, as a full-time health worker, it would be important to know how many hours per week I would need a budget for in the week.
There is a rule of thumb about that. And, usually, if you have a 3 credit hour course, in an 8-week condensed course, you'd need to add at least another 9 hours on top of that. So we're talking about probably 12 hours, maybe a little less, maybe a little more. And that's a rule of thumb, right? I mean, some courses are easier, some courses are more difficult. In one courses you'll spend, spend those 3 hours, on the, reviewing materials for the online courses and course related to, recorded videos and other things, and maybe another few hours just doing some reading, quick assignment, and it will be easy. For the other course, you'll spend 20 hours a week and, hardly actually make it to the assignment deadline, because some courses are more difficult, some are easier. There is really big difference between different students. The same course, one student finds extremely easy, the other very difficult, and the same 2 students will completely switch what they think about some other course. So it's very personal, but I would expect somewhere 10 hours minimum you need to budget every week to complete assignments, to go through material and so
on. And then the next question. I have a strong public health background and currently work at a nonprofit, but do not have a degree in public health. Can the intro public health classes still be waived? I am also a certified community health worker.
The answer is unfortunately no. And this is because we are a College of Public Health. And as a College of Public Health, every student in our college, which is CEF-accredited college, is required to take a public health course. And literally the only exception is for somebody who already graduated from CEF-accredited program. And we had this discussion back and forth, with academic affairs and with the accrediting body. And the short answer is actually no. You have to have a degree in public health in order to waive that class.
And then another question. Do you know how many students from the program go on to pursue the AMIA Health Informatics certification or some other recognized certification if there are more?
There are, so one is the AMIA. AMIA is actually American Medical Informatics Association, and actually the big AMIA meeting is actually starting this weekend. And this is where I'm actually going on, on Sunday, and we'll be there next week. And it's more of a research organization, and everybody doing research in informatics will be there. It's one of the big important meetings. We have a couple of students who do. For AMIA certification, there are 2 types of AMIA certification. There is AMIA certification, one is specifically for clinicians. And, these are, if I don't know what's your background, but if you are a physician, you can actually pursue physician certification from AMIA. And if you are, and there is another certification for doctorally trained students. And there is another type of certification at AMIA, which is more based on experience, but that actually requires many, many, many working years of experience. So you wouldn't be able to do it immediately after graduating. They do require many years of experience. However, more relevant to actually informatics, it's HIMSS. It's a CP HIMSS and CA HIMSS. These are two certifications which are done by different organizations, which is HIMSS, which is Health Information Systems Management Society. And these are essentially industry gold standards. If you think of AMIA as a more academic organization, HIMSS is an industry organization. And we have a good number of students that actually received CA HIMSS or CP HIMSS certification. We don't prepare you exactly to take the test. There is no course in the program that says, you take the test for CP HIMSS. But we did some pretty close mapping between what's required for CP HIMSS and to what we cover in the program, and there is a very good overlap. I wouldn't say it's everything, but it will make you very close to being prepared. You still need to, learn nuances, how to answer their specific questions on the test. But you'll be fairly close to actually getting to CP HIMSS exam after the program.
Alrighty. Any last questions? Can you talk more about the capstones projects that have been completed in the program?
Okay, well, I can talk about a capstone project, or I can talk in general. There are we have a couple hundred graduates from the program. So, there were actually lots of projects completed over the years, right? And I mean both combined in online and in-person programs. They're all over the place. Some students will go out there and analyze data about something specific and report on the results. We may have somebody, we have a person who is actually a nurse, and that person went to surgical unit in a hospital and extracted data about delays in the operating rooms. And the capstone project was really about understanding, when the delays happen, what are the causes for the delays, how scheduling can be changed to affect those delays, and lots of similar type of questions that she actually answered. So it was very purely data analysis project that in which data was extracted from EHR system, and that student analyzed that data. Some other student essentially worked with a team that built a cell phone app for a mobile intervention for patients with some chronic conditions. And that was a non-profit organization. That app got deployed, and actually, that a non-profit organization is used to provide educational materials to their patients. So they're all, and some are more managerial. So those projects are all over the place. Usually the scope is that it is actually doable within 8 weeks of the condensed capstone you have in the online project. Although the faculty that runs capstones, her name is Dr. Iman Elashkar. She actually reaches out to all students way, way, way before you actually start talking about get enrolled in the capstone project, because you need to be ready. You need to work on, finding the right place. Our faculty help you find a place, but finding an internship or capstone place is like looking for a job, and that's a skill you need to get to. So she reaches out to those to informatics students way before you actually start looking for the actual capstone, and walks you through the process, what needs to be done, and all the other things. So the moment you start the course that is about doing the capstone, you already have the placement, you know where to go, all the formal requirements are satisfied, all the contractual needs are done. If there is a need of a special contract between Mason or wherever you go, it's already signed. So on the first date of the actual capstone, you can go there and work on your project. So there's a process to it, and that process actually starts long before you start the actual capstone.
That's very informative. Thank you. Someone else asked money for in-state. I can answer that. There are no difference between in-state and out-of-state tuition for the fully online program. 12 courses equal to 36 credits, 3 credits per credit hour. That's about $800 per credit hour. So the total for tuition for the entire program is $30,120. Again, no difference between in-state or out-of-state tuition for the online. And then the person that asked the question about the practicum said, thanks for giving a sense of the process, range, and scope of the capstone projects. And that helps me as well when I talk to the students to get a little bit more information about what those capstone projects look like. So great question.
We can add one more thing to the capstone projects. Even this is fully online program, and many of you may be all over the country. Some students are locally here in Northern Virginia, and if you happen to be here, we have these very nice presentations of projects at the end, and online students can join virtually and present their work with the capstones. But you're actually physically in Northern Virginia, you're welcome to actually be in person at the presentations of the posters for the capstones. So we do this night's combined event at the end where you actually present your work.
Oh, wow, that's great. That's really cool. Awesome. Great questions, everyone. Any last questions as we start to wrap up? Does working in the health informatics require a certification to work?
No. No, and that is different, for example, from HIM, Health Information Management, in which you actually have to be RIA certified. In health informatics, actually, no.
Alrighty. Well, also everyone, if you're looking at this page now, if you scan the QR code, that would be the link to start the application. Our next upcoming term is spring. Its start date is January 8th. Deadlines for applications for the spring term are December 4th. Our next term upcoming is fall and summer. So that's kind of where we're at. And the next terms, sooner that you apply, the sooner you can get a decision. But we always recommend the sooner the better. I'm also going to put down my my contact information. If you are interested in starting the application, feel free to contact me or call the main line that I'll also input here.
And sooner also means that you get sooner access to the bridge course. That actually, if you're recommended to do the bridge course, you have more time to do it.
Absolutely. And that's a great incentive to start sooner rather than later, for sure. All righty. Well, thank you everyone for joining tonight. We got a good amount of people and great questions. And thank you, Professor Wojciech, for joining us tonight and taking the time out of your day to join us and give us some information about the program. It's really helpful for myself, and I know definitely really helpful and appreciated by the students as well.
Thank you.
All righty. Well, everyone, I'm going to stop sharing. But I hope everyone has a great rest of their night and enjoys their weekend on Veterans Day as well. So have a great rest of your night.